Hello, everyone, and welcome. Thank you for tuning into this on-demand webinar titled Step into Better Health with Custom Orthotics. My name is Stachiw, and I'm the founder of Stach Consulting, a Calgary-based digital marketing consulting firm. I'll be your moderator for today's session, which will be presented in a relaxed Q&A format. Today, we're shining a spotlight on a fantastic local collaboration between two female-led businesses here in Calgary who have come together to offer a streamlined approach to custom orthotics. So whether you're experiencing foot pain or struggling with posture or just generally curious about how custom orthotics can fit into your overall wellness, you are in the right place. So before we dive into things here, I'm just going to take a quick moment to introduce our two special guests. So joining us today, we have Dr. Rebecca Jane McAllister, a chiropractor based here in Calgary, who is trusted for her evidence-based approach to chiropractic care. Dr. Rebecca treats a wide range of muscle, nerve, joint, and bone conditions and has a strong focus on personalized treatment, ranging from spinal manipulation and acupuncture to exercise rehab and, of course, custom orthotics. Her passion lies in empowering patients to understand and better manage their pain. Also with us today is Breanna Turner, the owner of Crux Laboratory, a local manufacturer of custom medical-grade orthotics. Crux is all about precision, innovation, and sustainability. Their team uses 3D advanced technology to craft durable, high-performance orthotics tailored to each individual. Breanna's commitment to both quality and collaboration makes Crux a trusted partner for various doctors across the nation, including Dr. Rebecca. So as I mentioned before, together, these two professionals have created a seamless process for delivering custom orthotics that not only support your unique lifestyle, but can help to improve your overall movement, alignment, and comfort. From the first assessment in the clinic through to final fitting and break-in guidance, which is provided, the collaboration between Dr. Rebecca and Crux Laboratory is truly patient-focused. So with that being said, and without further ado, let's get into things here. I'm going to ask each of these ladies a series of questions today. I think we have 6 or 7 total. That will help you, the viewer, understand how this partnership works, how orthotics can help with common health conditions, as well as what you can expect if you decide to take the next step in your wellness journey. So to kick things off here, perhaps we can start with you, Dr. Rebecca, just speaking to some of the basics of how this works. So what's the actual process for getting custom orthotics? And to add to that, a big thing that I'm sure people always ask you or are wondering as they watch this recording, are they covered by insurance?
Yeah, that's a great question. So most insurance companies have coverage for custom orthotics. So I always recommend that people check and review their individual insurance plan requirements.
Mm-hmm.
In my experience, often the insurance companies will require a medical doctor's prescription dated prior to the date of the orthotics assessment. And if that's the case, that's really important to have so that you get reimbursed for the orthotics with your insurance company.
Mm-hmm.
If that letter or prescription is needed, once you have it, then you can book an orthotic assessment with myself, where we'll evaluate your posture, gait, and foot structure, and then take a 3D foot scan of your feet. And then I will complete a detailed orthotic order form, both of which are sent to Crux Laboratory for custom fabrication. Typically, it takes about 2 to 4 weeks for the orthotics to be manufactured and delivered back to the clinic, at which time we'll schedule a dispensing appointment so that we can make sure your orthotics fit and provide you with the guidance you need to ensure a smooth, supportive break-in process.
Fantastic. Awesome. Thanks for that insight, Dr. Rebecca. Now, question 2, this one's for both you, but Breanna, feel free to kick things off here. Who actually benefits from wearing custom orthotics, and what types of shoes or other footwear can somebody wear them in?
That's a great question, Chris. So it's actually a really common misconception that custom orthotic being a medical device means you need to have a major deformity or a chronic condition in order to benefit from them. But realistically, if you have aches and pains, if you're struggling with standing on your feet all day, you have recurring injuries to the lower limbs and feet, there's a good chance that an orthotic could be a good fit for you. There's a range in complexity and a whole range of styles. And so we can fit an orthotic into just about any style of shoe, from a running shoe to a hiking boot to a work boot and even a fuzzy bunny slipper. So long as there's a sock liner that can come out, those factory liners that are built right into a shoe. So one thing that I would note is that every orthotic style has its own intended use, and that's where the assessment process comes in, where getting that dialed in on your intended usage, your needs, your lifestyle, and just about anything you can imagine, we can fit an orthotic into it these days.
Awesome. That's great. Great to know. Awesome. Okay, so maybe let's dive a bit deeper with you, Dr. Rebecca. What types of conditions do custom orthotics help with? And Breanna, feel free to add anything from your side as well.
Yeah, so that's a really good question. So as a chiropractor, I provide custom orthotics for musculoskeletal or MSK conditions. So again, conditions pertaining to the muscles, nerves, bones, joints of the body.
Mhm.
So some examples might include plantar fasciitis, heel pain or heel spurs, flat feet, fallen arches, or high arches, metatarsalgia, shin splints, knee, hip, or lower back pain, Achilles tendonitis, foot and leg fatigue, arthritis, as well as for general comfort and support. But I do know that custom orthotics can also be helpful for conditions that fall outside of the MSK system. So I'll pass that off to Breanna to touch a little bit on that.
Sure.
Absolutely. So a custom orthotic can be pretty much any sort of device that is supporting the feet from below. So we can get beyond the musculoskeletal cases and into more complex needs such as diabetic wound care and neuropathy, arthritic pain, major correction, so gait retraining. So these practitioners are usually a little bit more specialized in the foot-specific industries. So these would be chiropodists, podiatrists, and podorthists, which are most commonly available here out on the west end of the country, chiropodists being a little bit more common on the East Coast. But these specialists are easy to connect with, and clinicians like Dr. Rebecca are usually very comfortable referring on if your case is a little bit more complex than the MSK type diagnoses that she had mentioned.
Yeah,
Fantastic.
and I think that's important to note too, that if you don't know what type of modifications you might need in your custom orthotic, getting booked in with someone who can start that assessment and identify whether or not they're the appropriate provider to assist you with it
Mhm.
is a great first step, because like Breanna said, if a case arises that needs further investigation or a different healthcare provider, I'm happy to help facilitate that referral.
Fantastic. Awesome. Okay. Next question here. This one's for both of you. Maybe Dr. Rebecca, you can kick us off again. How exactly do you two work together throughout the orthotics process? And again, from a personal standpoint, it's fantastic that, it's such a collaborative setup, especially with both of your companies being local here in Calgary, right?
Yeah, I think that's a really great question. And that's one of the pieces about collaborating with Crux Laboratory that I really appreciate. And
Mhm.
that's after I submit a 3D foot scan and the detailed orthotic order form. Breanna and I hop on a call to review the case in the order form to help ensure that the most individualized and custom build possible is manufactured in each custom orthotic device that I provide. And
Mhm.
so I always really appreciate those phone calls and being able to collaborate with other healthcare providers to just up level the care that is provided to the patients I see.
Mhm. Absolutely. Anything to add to that, Brianna, there?
Yeah, I would just note that collaboration and finding the value in that definitely goes both ways. I mean, as a manufacturer, our role is really behind the scenes, but at the end of the day, what's most important is that we're making the exact right device that patient's going to benefit the most from. And so when we think about someone having the best experience in custom orthotics, it's not so much just like the in-clinic care that they're receiving, though of course it's exemplary care if you're seeing Dr. Rebecca or clinicians just like her, but also that the orthotic is well manufactured, it meets the clinical specifications that are required, and it's such a diverse industry. And so we're always available for phone calls and emails, and whether the clinician is super experienced and is just facing a slightly trickier case than they're used to, or just wants some other options. We keep our finger on the pulse of materials that are made available and device specifications that people are benefiting from. And that allows practitioners to keep their focus on their patient care. And then we can specialize on the orthotic collaboration side. So I think she hit the nail on the head in her description of what that process looks like.
Absolutely. Yeah, safe to say the collaboration is key, right? And placing the patient front and center, right? And for their individual needs, right?
Absolutely.
Definitely.
Awesome. Okay, let's talk about numbers for a second, Dr. Rebecca. So what's the cost of custom orthotics? And I know price can vary depending on where people go, right? So maybe you can walk us through what patients can expect price-wise.
Yeah, that's a really good question. So, like you said, cost can vary depending on the clinic. It can also vary depending on the type of practitioner that's providing the orthotics.
Mhm.
So, currently in my practice in Southeast Calgary, the cost of orthotics is $500. Again, I keep my website updated and current. You can always see the cost of all my programs and services online in real time.
Mhm.
And I also think it's important to note that occasional promotional offers may be available throughout the year. And if that's something that's of interest, I would also encourage you to add yourself to my email community. That's the quickest and fastest way that you will learn of any potential promotions or discounts that are offered.
Fantastic. Awesome. Okay, and then we're already at our last question here, which is great. So, once someone has their orthotics in hand, what happens next? And Dr. Rebecca, maybe you can explain kind of what happens at that follow-up appointment, which I understand is a quite important stage in this process. And then Breanna, I'd love to hear, what goes into ensuring those orthotics are built to last, basically, right?
Yeah, so again, another really good question. So once the orthotics are manufactured and back at the clinic, we will schedule a dispensing appointment so that we can fit your orthotics to you. This looks like trimming your orthotics to fit the footwear you intend to put them in. So I always tell people to bring in their footwear that they plan to wear the orthotics in at their dispensing appointment. And then we also discuss and go through guidance on how to ensure a smooth, supportive break-in process, which is often a lot of information. And so I also provide people with a home instructions document so that they don't feel like they have to memorize everything in clinic
Mhm.
and that they have something to refer back to if they are like, oh shoot, I forgot what she said about how many hours I should start on day one wearing my orthotic, or I forgot what she said about if I'm experiencing blisters or hot spots.
Mhm.
Everything they need with my contact information is on that home instructions document so that it's an easy reference guide for them.
That's great. Awesome. Anything to add to that, Brianna, from a manufacturer's side of things?
Yeah, absolutely. And so once the orthotics are in the shoe, it's not really the end of that relationship. I often look at orthotics almost more akin to eyeglasses, where it may not necessarily fix your vision, but you will get the most benefit out of them for longer term wear, and most benefit when you are actually wearing them. And
Mhm.
so the orthotics are really built to last long term. The shell material that we use is built to last for at least 5 years. We warranty for a 5-year minimum period, meaning that
Okay.
it should not break down, become too flexible, collapse under your weight. If it happens to happen, hasn't happened so far, we would completely replace the device at no charge. We also warranty our top cover and the softer materials that go into additions and accommodations for a 90-day period against premature delamination and breakdown, as long as a modification policy. So once the orthotics are fit to the shoe, if things aren't quite feeling right, we strongly recommend getting back in touch with your clinician. Give Dr. Rebecca a call, let her know things aren't feeling right. She'll take a
Mhm.
look at the orthotics, compare them against your feet, make sure that there aren't any, manufacturer defects or changes in the requirements of your prescription. And we would alter that device at no charge as well. So we're really here to make sure that you're comfortable long term.
Mhm.
And then when you are wearing them and they're quite well loved and maybe a little bit beat up, you're not getting quite as much support or cushioning as you're used to. We also offer really affordable refurbishment services to make those orthotics last as long as possible.
Yeah,
Fantastic.
and to echo that, there are two pieces of the warranty piece that Breanna mentioned that I really just want to echo. And the one is the 90-day warranty. That's huge. Having 90 days to make any modifications to the device as you start to wear them, break them in, live in them is very generous. And patients that I've fitted for orthotics in the past are really appreciative of that. And the
Absolutely.
other thing that Breanna mentioned that's huge is I often think that people feel like after they get their orthotics, if they start to lose that shape or that support, they feel like they need a whole new, brand new pair of orthotics.
Mm-hmm.
Sometimes they do, sometimes they don't. And so, again, having that relationship with the practitioner that initially provided the orthotics to you, you're able to book back in, have that conversation of, okay, do I need a whole new, brand new set of orthotics, or do I just need some refurbishment on the pair that I already have? And refurbishment is often a very economic alternative to a whole
Mm-hmm.
new, brand new pair of orthotics. And so,
Mm-hmm.
again, people really seem to appreciate that approach as well, considering the cost and their budgets and what they truly need at the end of the day for their health and well-being.
Yeah, absolutely. That's awesome. One of the things I took away from that is clearly the relationship doesn't end with either of you when the orthotics get in the patient's hands, right? Open door policy, for lack of a better term. Any questions, concerns, they can reach out to either of you, correct?
That's right.
Definitely.
That's awesome. Great. Okay. Well, that wraps up our on-demand webinar. We appreciate you for joining us. A big, big thank you to both Dr. Rebecca and Breanna Turner for sharing their time, knowledge, and expertise with us today. From a personal standpoint, it's very inspiring to see, two local businesses working together to bring this thoughtful process and custom orthotics to our community, right? So if you're interested in learning more about the manufacturing side of things, including the 3D printing process, or, Breanna, you alluded to this earlier, the different orthotic styles that are available, I encourage you to please visit cruxlaboratory.ca. Alternatively, if you're ready to take that next step in your own health journey, the best place to start is with an orthotics assessment with Dr. Rebecca. You can book an appointment directly through her website at drrebecca.ca. Thanks again for watching.